Welcome to the Dental Brief, the world's direct, right-to-the-point podcast produced to get you the information you need to learn and grow your practice. To learn more about our guests and find links to information discussed on our show, visit our website, dentalbrief.com. On to today's episode.
Hello, everyone. Welcome to another episode of the Dental Brief. I'm very happy to have with us very special guest today coming from Georgia, Dr. Rico Short. Say hello to our audience.
Hello, guys. Hope you guys are doing well today.
Hey, glad to have you here. Always grateful when a dentist comes on the program to share with our audience and help other dentists out. Dr. Short, you're an endodontist. Tell me how you got into dentistry and how you got into your specialty.
Well, I got into dentistry kind of by default. I was raised in a single parent household, and my mother, we didn't have a really high dental IQ, so I always found myself in a dental chair. And I was one of those kids that loved candy, ate a whole bunch of candy, and just did not really take good care of my teeth. And I just remember having these bad toothaches and always going to the dentist and getting things done. And in high school, I knew I wanted to be some kind of doctor, and I liked math and science. And I figured that, you know what, dentistry may be the path of least resistance because I'm always at the dental office getting stuff done to my teeth. So it felt like I was already a dentist before I even went to any kind of formal education training. And then I ended up having a mentor in my hometown of Columbus, Georgia. And he was an African-American dentist. And actually, he was the first African-American doctor I've ever seen or met. And he mentored me and really helped me try to figure out if I wanted to do dentistry as a career. In the summertime, I would hang out at his office and file charts and do those kind of things. So I watched him do a lot of cool procedures and things like that. And that kind of sparked my interest. And he became my mentor all the way throughout undergrad and also throughout dental school.
It's a terrific story. It's always great to hear how people got to where they're at and to kind of get a taste of where they're going. So being an endodontist, you're working with, general dentists all over your area. And I know you've written some books, and we'll get to that in just a little bit. But tell me, what are some problems that you see general dentists facing today, some issues and problems that they're coming to you with or that you see them having?
I see a lot of general dentists really getting over their head on a lot of complex cases, and I know a lot of general dentists want to be this super generalist and do everything. And, I tell people, you want to just specialize. I was a general dentist, so I'm not, I'm speaking from experience. When I was a general dentist, I wanted to try to do all this stuff and realize it was really stressful trying to master everything, and you just want to find a couple of things that you're really good at and hone at and do it. But endodontics is one of those things that can drag you through the mud if you're not careful. There's no quick shortcuts. Everybody want to have a shortcut way. Give me this magical file, this magical formula. And unfortunately, every tooth is different. So there's no real magical formula. You could get yourself in a bunch of trouble. In fact, I had a dentist, as a fact, yesterday, he got into a case and he got head over his heel. He separated a file. Patient had a lot of infection there, and he started freaking out, and he wanted me to fix this thing immediately. And I said, hey, I can get it fixed, but I can't do it right now and stop everything I'm doing because some of these procedures can take an hour just to get the file out. Well, he was upset at the situation, and I calmed him down. I was like, hey, this might have been one you should have probably referred out, and now I'm going to have to try to calm everything and keep this patient from calling the board and getting this dentist in trouble. And also the dentist, he didn't want to pay for the treatment. I'm like, here it is, this issue had on your hand, the blood is on your hand, so to speak. At
Sure.
least you want to try to make sure that you take care of the patient so this patient don't go irate and call the board to get an attorney. So at least pay for the treatment and then let me handle it, and then we'll take care of it. Well, he didn't want to do that. He wanted to try to handle it himself. And I've seen this story play out numerous of times in my 25 years of being an endodontist, and it's just not going to play out well. And he's a young dentist, and he wants to do it all his way. And, we'll see what happens. And that's the main thing. I see a lot of dentists, they get way over their heads. They don't have a really good relationship with an endodontist. They send some endodontist just all their, grub work, the trash work. They don't really throw them a nice bone here or there. And then they want you to bail them out. And that's just hard. That's just like, it's like being in an abusive marriage. Here it is, you're saying one thing, and all of a sudden you're in a tight situation. You want to bail them out, but then you don't hear from them any other time. So that's the other thing that really you got to be careful as a general dentist. You want to make sure that, you take care of your specialist, your endodontist, send them some nice cases every now and again, and also just communicate, and if you made a mistake, just admit it. Let us know, hey, what, I broke a file. Hey, I made a perforation here, so we can know what we're dealing with, so that we're not blindsided, so we can help you manage the case, and more importantly, manage the patient. And so that's one of the things that I'm seeing now. And it's just, becoming an epidemic. And I tell people the smartest dentists are the ones that know how to pick and choose their battles in endodontics, and also, have a good referral reputation with their endodontist.
And that's business in general too, though, isn't it? It's not just dentistry, right? I mean, it's not uncommon for people in business to start chasing butterflies, right? Or trying to, find the next the next golden goose, if you will. So you get into, clear aligners or ortho, or you get into implants and placing implants, what have you, because you think, hey, this is the way that I'm going to make money. But it's really, you're just chasing something that you could have if you just really focused in on, forgive the term, but bread and butter dentistry, right?
Yeah, and I, like I said, you can do well doing bread and butter dentistry, and also you can do well if you have a passion for endodontics, okay? Sure. And you go to the courses and you take continuing education and you do hands-on, and you listen to some of my podcasts on endodontics, and I just released a textbook, and if you get immersed in that, you will be able to pick and choose your cases. And if it doesn't go well, you already know the steps that you need to take to make sure the patient and the case have a favorable outcome. But if not, you're just really creating just this, you just create more stress than you already have on your shoulders. And you're right, you get into all this thing in dentistry, platform is so wide. I mean, there's so many things you can get into, but when you start putting your toes in every single hole, eventually, it's going to get broken. You have to pick and choose your battles. And I tell general dentists, I mentor many general dentists all over the country, even worldwide. And I say, look, find those things that you're good at and you're passionate about. And then you focus on those things, and all the other stuff, just send it out. And you'll find yourself being more profitable, more, proficient and efficient, and be happy, about the profession that you've chosen.
Yeah, makes a lot of sense to me, and I'm sure it does our audience too when we think about it. Let's talk about your account on Amazon, and encourage our audience to check out. Go to Amazon, search Dr. Rico D. Short, and you'll find books, videos, so much content on here. And I know you have this textbooks coming out. You've got another book out, Getting the Root of Your Problem. Let's talk a little bit about In the Eye of the Storm, or In the Eye of a Storm. Tell us a little bit about that book.
Well, In the Eye of a Storm actually was my second book I released. And I was basically at a water park with my family going down a water slide, and I'm usually risk averse. And I'm going down the water slide. I end up hydroplaning off the slide, and my thumb went through my left eyeball and almost knocked it out. So I was blind in one eye, this catastrophic injury. So I couldn't practice. I was losing income, and I didn't even have a surgeon to work on me for about 4 or 5 months. And so here it is. I'm like, thank God I kept my, number one, disability insurance. Number two, my business office overhead expense insurance. And number three, I had a 6-month nest egg. So if something were to happen, I don't have to just panic and feel like, oh my God, like I'm going to lose everything. So fortunately, I had those things to kind of help me through this storm I was facing. And through all that, I didn't have an associate. And so I was trying to figure out, am I going to keep my practice? Am I going to be able to have to sell it? And I actually kept my staff on board. And I was going through this storm for about 7 months. And so during this process, I was trying to figure out how in the world am I going to, number one, stay sane? And I had to really rely on my faith in God, my faith in just trusting that no matter what I'm going through, he's really going to help me through it. And so I started journaling. I started journaling my fears. I started journaling my faith, and I started just writing these things out. Well, lo and behold, all these journal entries actually turned into the book. So towards the end of this eye thing that I was going through, I decided to release this book. So I wrote this book with one eye. So you will see some punctuation marks. You will see some passion. You will see some tears if you go and check out this book, because it's a real life while I was going through the process. And I ended it, I don't want to give the story away, but I ended it when I didn't know what was going to happen, because I wanted to make sure that I published this book in the middle of my storm, not on the end where you have a nice bow wrapped and everything is great. So that's the journey. And it's 45 days of turbulence and peace, 45 days that I experienced turbulence, and I had to find peace through the turbulence. And I wrote it because everybody is going to go through a storm. You may go through a financial storm, you may go through a marital storm, you may go through a storm in your health, like I did, in your business, and how you handle those storms, it's really important. So I was able to pour in a lot of those things that I learned from other mentors and things that I learned through my faith to help me get through it. Now, on the other side of the storm, now I have to kind of tell people how it actually turned out. And thankfully, it turned out really well. And so I've had an opportunity and have the opportunity to be able to talk about this on various platforms. In fact, I'm one of the featured ADA speakers in Houston that's coming up, and I'm going to share that story. And I'm excited to be able to share that story about how I was able to make it through my storm and encourage other people to make it through theirs.
Yeah, it's a terrific story, and appreciate you sharing that. I'm going to ask you one more question. Let's say somebody's doing some endo in their office and they are passionate about it, they really want to get great. How do you recommend they go about finding the best possible courses to take?
Yeah, so there's a lot of courses out there to take. One of the things that I would recommend is go to the AAE website, www.aae.org. And then you just find where there's courses available. And I'm also a volunteer speaker, and I go and speak all over the country about different topics in endodontics, diagnosis, irrigation, obturation, trauma, those kind of things. And those are tools where you can kind of get in order to be more proficient at doing endodontics. And also some hands-on courses. Hands-on courses are great. They're there. Some of the things that you kind of have to be careful about is some of the I call them heavily sponsored courses. I'm independent. I'm one of the few independent speakers out there. So I don't sell products. I talk about products that I use or I have used. I talk about the good, the bad, and the ugly in some of these products. And then I kind of move forward. So some of the people are unfortunately salespeople. And I always try to, encourage a lot of my viewers and listeners to be careful when you go into a sales pitched type of course, because they're going to tell you that their files is the best and they don't break and da 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 da. And there's a lot of fluff in that. All files can break, because everybody asks me, what's the best file? Which one won't break? I'm like, if you use it, it can break.
Sure.
So the thing is knowing what you're using, why you're using it. Can you use it in this particular case? Because there's no cookie cutter method. Like there's no one file that fits all, one technique that fits all. And so, the more you know on how to choose your armamentarium, the better you'll be. I mean, no one's going to take, a Lamborghini off road because it's not designed for that, So there are certain files that are designed that you can take off road, and there's some that works better on a straight road. And I talk about that in my lectures and talk about all these different file types that you can use, and also talk about the kinds that, it doesn't really matter in this case. Some cases, it doesn't really matter what you use, So those are the kind of things that I talk about. So you just kind of be careful when you're going out there and sign up for some courses, and just make sure you're not, in a sales pitch type of room.
Sure. Yeah, I appreciate that. I want to thank you one more time, Dr. Short. First, I want to encourage our audience, check you out on Amazon. Go to Amazon, search Dr. Rico Short or Dr. Rico D Short, and we'll find you there. And just, again, Doctor, thank you so much for being here. We really appreciate your time.
My pleasure. And also to the audience, if you do any social media, you can always find me on Facebook, Instagram, and LinkedIn. I post a case daily called the Short Case of the Day. And it's a free case. It tells you tools and tips of cases that you may want to attempt, cases you want to send out, and just give you tips on how to treat certain cases. And so I've been doing this for almost 10 years. In fact, I think I was the first endodontist that started putting cases out and telling people, hey, this is what we can do as an endodontist. And now everybody kind of jumped on the bandwagon, which is cool. And also, too, if you as a dentist, I want to encourage you, show your cases, show your best. You have a skill, you have a talent. The world needs to see what you can do. So don't hide your talent. You know, if you're a social media person, put your cases out there. You know, people need to see what you can do as well.
That's awesome. And I'm just going to make sure it's facebook.com/root canal doc, DOC, correct?
That's correct.
Yeah, awesome.
And
Check it out.
Yep.
Yeah, definitely. Audience, please check it out. And Dr. Short, again, appreciate it. Thank you so much.
My pleasure. Have a great day.
Thank you for joining us on today's episode. Did you know you can weigh in on today's topic on Facebook? Search The Dental Brief on Facebook or visit our website, dentalbrief.com, and just follow the link. We look forward to having you join us again on another episode of The Dental Brief.